Cassidy.
Borio. During the Ebola outbreak, several agencies, including USAID, the Defense Threat Reduction Agency, issued broad agency announcements seeking proposals for devices and diagnostics to respond to and contain the Ebola outbreak. Did the FDA implement an expedited approval process for these devices? How long does the expedited review process take, if they did? And can the FDA trigger it with existing authority, or do you need a specific request from another federal agency?
Well, our outreach in the diagnostics has been one of the most active. As a result of proper authorities, we've been able to issue EUAs for now 8 diagnostic tests. Our staff...
So your existing authority is adequate?
Yes.
Okay.
And, and our staff basically stand ready to review submissions as they're received. As an example, the first test for Ebola that was authorized for use under an EUA was a DoD-developed test. We're able to authorize it within 24 hours. Okay. The most recent EUA was issued after staff, on standby, worked through the weekend to review the application. So,
well, hat tip to you all for being so prompt. Thank you, and I mean that sincerely.
Thank
you. Red. March of 14, Guinea had reported. Now, as I reviewed the literature, I think it was back in Zaire long ago that there was an outbreak of Ebola that was contained, and we knew how to contain it. So in March of 14, Guinea had reported 49 cases, within weeks spread to Liberia. Now, I remember seeing an MMWR report on this, and sometime I couldn't dig it back up, but sometime early summer, CDC had field workers in the affected countries. And so y'all were aware of this and were in the process of responding. It wasn't, though, until the cases reached the thousands and Americans were getting infected that we really triggered that huge response. Now, y'all mentioned that you are doing kind of a post-mortem. I don't mean that in a grisly sense, but, a kind of after-the-fact analysis of what's going on. It begs the question, though. You got trained public health there. You know how to stop it, but you see the genie coming out of the bottle. Why did it take this sort of kind of dramatic increase before the hammer went down and those resources were fully requested?
Yes, sir. The outbreak was identified in March of 2014. A large team responded to that, a multinational team led by the World Health Organization. The disease was brought under some measure of control, but not enough. The entire team redeployed in May, June, and
now wait. There's something you left out. Redeployed, meaning they were yanked out.
They came back. Yes, sir.
Now, what was the incident rate, and what was the geographic spread in the interval between they were pulled out and it began to spread once more?
I can get you the exact numbers. I don't have those on hand right now, but I think I would take your main point that that was a mistake.
Now it's easy with retrospectoscope to look back and say it was a mistake. But reasonably speaking, again, I'm asking because CDC, you're good. You're real good. You would know, wait a second, there's a case over here that previously has not been. Maybe we should not pull out. Did you have the ability to not pull out if World Health said yes, but you said no?
I think in retrospect, we would not have pulled out. So let me just continue on, because the Emergency Operations Center at CDC was activated at the beginning of July, and that was as cases in Liberia and Sierra Leone were detected. And we've been activated since that time, our highest level of activation since early July. Cases really, there was an exponential increase that began in August and September.
Now, the exponential increase, just intuitively, you know that there was a slope that began to ascend. And this is a curvilinear slope, so it's going to begin like that, and then it's going to rocket ship up, right?
Yes, sir.
So I guess the question I come back to, I mean, Senator Alexander has left, but it seemed like there should have been somebody on the ground saying, listen, we're seeing a curvilinear increase in the number of cases. This thing's about to take off, and it shouldn't have taken an American missionary to get infected. You follow what I'm saying?
I do. And I want to just say that the recognition of the problem did not coincide with the detection, with the people coming back with infections. It was before that.
Well, believe me, I understand that. Yeah. You guys are so good. You saw that graph, that incident rate beginning to increase. And that begs the question, though, Did it fall on deaf ears? Did people there make a mistake in not asking for more help? Because there was a critical time where you could have stopped it, and yet it took off.
I think that there was a period in May and June when a more vigorous response could have made a big difference.
But again, I come back to my question, and maybe you can't answer. Were the resources requested and not given, or were the resources not requested?
In July, when we went back in, we recognized that there was a problem. The actual request for large resources, I think probably the full recognition of the problem was not until September, and that was when, as you'll recall.
But August is when the exponential increase began. Did I hear that correctly?
There was a lot of work trying to figure out what was going on during that period of time.
But you're not answering I don't mean...
Well, I'd say that I think that the period when the exponential increase was recognized was in early September, and the resources were requested shortly thereafter.
But the American returned in August, and so that's when I think it started to garner a large amount of attention. I assume there was a death rate. You could just look at the Liberia version of an obituary and have a sense of the death rate. It was so deadly. I guess what I'm not fathoming is since your death rate is such a ready indicator of something bad happening, your death rate's increasing. I don't understand the lag time between the requesting additional resources and the body bags filling up, so to speak.
Well, all I can say is as soon as we recognized the extent of the problem, we began to work harder and to try to define what resources were going to be needed. And as soon as that request was formed, it was made.
Okay, I yield back.
Thank you, Senator Cassidy. And let me, I'll wait for Senator